Hi, my name is Leah Parker, and this is my cardiothoracic assessment video. And what is your name, sir?
Tony Parker.
Do I have your permission to do a cardiothoracic assessment on you?
Yes.
Okay, here we go. So first we're going to be inspecting anterior, posterior, and lateral wall and chest. And by doing that, I'm going to be looking through this area, posteriorly, and I'm checking for any lesions or abnormalities. And I'm going to ask you to go ahead and lift your left arm up, checking under there, no abnormalities. Then I'm going to ask you to lift up your right arm. You can put your left arm down. Checking there, no abnormalities. You can put that arm down. While I'm checking, I'm going to be noting his respiratory rate and rhythm, if he is using any axillary muscles or having any retractions or any dyspnea. Then I'm going to be palpating his chest wall for tenderness with the back of my palms, and this will be checking for any crepitus or any Rice crispy fillings that could be an indication of a pleural rub. So I'm going to have you go ahead and turn your chair all the way around. Thank you. And I'm going to ask the patient to repeat the word mine over and over while gently rocking my palms up and down his back. Can you please repeat mine over and over?
Mine, 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 mine.
Great.
Mine.
And you can stop. Great. I do not feel any crepitus, so that's good. And you can go ahead and turn back around. Oh, I'm actually sorry. I'm going to keep you turned around because now I'm going to check for thoracic expansion. And by doing so, I'm going to be putting my hands at the 10th intercostal space, my thumbs to the left and the right of the sternum. And then I'm going to ask him to breathe in deeply and breathe out. Go ahead and keep doing that. While he's doing that, I'm going to be assessing the symmetry of my thumbs to make sure expansion is equal on both sides. Asymmetry could indicate a collapsed or partially collapsed lung. Okay, go ahead and turn back around, please. Now I'll be doing the same thing on the front, but doing it at the xiphoid process with my thumbs to the left and the right of the sternum. And I'm going to ask him to do the same thing. Breathe in, breathe out. And again, I'll be assessing the symmetry of my thumbs, moving up and down to assess whether or not there's any kind of collapse. Good, thank you. So now we're going to be moving on to percussing. We're going to be percussing at 4 different spots on the front, 4 on the side, and 5 on the back. We're going to do this on each side to check that it is normal bilaterally and that there's resonance in between the intercostal spaces. I'm going to percuss, so I'm going to hit gently, okay? Great. Can you go ahead and lift this arm up for me? You can put that arm down. Lift this arm up, please. Good. Those were all equal and bilateral. I'm going to have you turn around to do the back. Thank you. Same method, going side to side to make sure that it is equal on both sides. Now I'm going to go ahead and auscultate those same areas, and for comfort's sake, I'll do the back first so he doesn't have to turn. Every time you feel my stethoscope move, if you'll try and give me a deep breath in and out. Thank you. Lung sounds were normal. No adventitious sounds. No diminishing. Now I'm going to have you turn around to face the front. And I'm actually going to do under your arms first, so lift your arm up, please, and listen at the same points of percussion. Same thing when I move my stethoscope, go ahead and breathe in and breathe out. Good, you can put that arm down. Go ahead and lift this arm up. Excellent, put that arm down, and then I'm going to listen to the front. All right, thank you so much. Okay, now we're going to move on to the cardiac portion of this, and we're going to start with inspecting the pericardium portion of the chest, which will be right here over the heart, and also by identifying your aortic, pulmonic, tricuspid, or Erb's point, tricuspid, and mitral points of sound. So your aortic is going to be at your second intercostal space to the right of the sternum. Your pulmonic will be the second intercostal space to the left of the sternum. Below that will be your Erb's point at the third intercostal space to the left of the sternum. Below that will be your tricuspid point, and that is going to be your fourth intercostal space to the left of the sternum. And finally, your mitral point of listening is going to be at your fifth intercostal space to the on the midclavicular line. I'm also going to note here that his epigastric area is going to be below his rib cage and above his belly button. So it's going to be in this area here so that we can identify any pain if there is any in that location. Do you have any pain there?
No.
Good. All right, so since I've already identified aortic, pulmonic, Erb's, tricuspid, and mitral, I'm going to go ahead and listen in those same areas. And I'm just listening for normal heart sounds, S1 and S2, identifying them, and taking note of any murmurs, thrills, or adventitious sounds. All right, thank you. So now I'm going to go ahead and have my patient lay down so I can continue my cardiac assessment. We're going to probably have to maneuver the camera just a little bit. I'm going to have you put your head at that end, please. While he's laying down, I'm going to go ahead and locate his PMI, and that's going to be at the fifth intercostal space at the midclavicular line. While I'm palpating that PMI, I'm also going to be feeling for any vibrations that could be heaves or thrills, and I do not feel any of those. Now I'm going to be auscultating his precordium area in 5 locations. I'm actually going to start that portion over so that the camera can see.